Welcome back to Hometown Healthcare, where we are interested in perspectives and innovations in community healthcare. I'm Charlie Barnes IV, fourth generation owner of Barnes Healthcare Services, also known as Barnes Drug Store here in my hometown, Valdosta, Georgia. Today, we are joined by Dr. Lynn Lee, who is also a physician that practices in Valdosta, Georgia. And I'm excited to have a conversation with you today, Dr. Lee. So if you'd like to give any further information about yourself and do a little intro and we'll get started.
Good afternoon. My name is Lynn Lee. I'm an internal medicine physician here in Valdosta, Georgia. I'm a partner in South Georgia Medical Associates. I've been here in the Valdosta area for the past 20 years, taking care of everyday people.
That is awesome. That is awesome. And of course, you are on the front lines every single day and taking care of people. And it's such a valuable work that it is that you do and so many challenges. So, when we think about community healthcare, what's something that you're most excited with in community healthcare that you'd like to share with us in that regard?
Well, just a lot of the technology, the new treatments. I see a lot of people with diabetes, hypertension, newer treatment options that are available. I'm still about preventative care, and COVID's kind of, taking us all for a loop, but we still have to focus on preventative care and still be safe during the times of COVID. And, I'm not the most tech savvy person, but really had to jump in feet first with the telehealth and how to take care of patients and how to have them take care of themselves as well, and what resources are available. And, people are buying a lot of stuff from local pharmacies where they're doing their own pulse oxes. A lot of people with the technology for the blood sugar monitoring, with the continuous glucose monitoring. And, a lot of this information can be downloaded electronically so that we can limit, your problems with having to come out, and that you can transmit this information to your physician.
Are you excited about the technology? Are you using it differently now?
Well, I had to embrace it. Times are changing and we're all going to have to deal with it. I see a lot of older patients who haven't been real receptive, stepping up into this day and time, but we've been willing to work with them. My nursing staff will sit down and talk these people through how to connect for their telehealth visits and how to transmit and how to talk to them about using portals and different things like that. And we tend to be flexible and willing to work with these patients and using resources like what you all offer as far as telehealth to be able to talk about diabetic education, what resources are available, who do we need you to connect with without having the people to come outside of their homes and, like I said, but still get things done.
I gotcha. Over the next year, do you see, as far as advancing community health or getting better health outcomes, is there anything on the horizon or anything that you're doing now that you're really excited about that's going to maybe have significant change?
Like I said, with the technology, you've probably seen some of the advertisement about doing the EKG. We do a lot of remote cardiac monitoring through a company we service here. And a lot of people aren't aware of that. And how we can track you through those type of devices that are becoming more prevalent and that are more affordable. A lot of the times cost was an issue with a lot of this technology. Being able to expand our telehealth for me to be able to really get a feel of what's going on with you. Yeah, I can talk to you over the telephone, but I need to know what your heart and lungs are doing and the technology that'll allow us to be able to do that.
What percentage of your practice would you say is engaging in some way in a telehealth service of your patients?
Early on, probably when, in March, April, May, pretty much probably 80-90% of our visits during those months were telehealth. Mm-hmm. Back doing in-person appointments, we have certain protocols and procedures in place to make sure we protect the patients and ourselves as well. And we still offer patients, like I said, telehealth, but if they can't be seen or certain things that we can't do remotely, we, bring those patients in.
That's a lot, right? And I think that's happened across the country, 80-90%. I mean, that's really, it's necessitated a lot of change, and I think we'll see a lot of innovation and within the healthcare sector in regards to technology, absolutely. Back to your mention about preventative and which is a lot of that's about lifestyle and, mm-hmm. and especially, your diabetes or your pre-diabetes or high risk patients. rising risk patients, is there something that you do or recommend to your patients that you see great results with?
Well, some of the newer medications that are available out there, but beyond oral agents, a lot of people can be, against taking any type of injectables, but there are a lot of once weekly injectables that we've used a good bit of. And, education is still key when we introduce new medications to patients so that they have an understanding about why we're doing these things and why we recommend these things. I think people tend to be more receptive if you try to explain to them why you're making certain decisions. And like people are against the continuous glucose monitoring, things like that. No, I don't want anything connected to me, but we need to know what's going on with your numbers so we can treat them appropriately.
How do you see, and I'm wondering your perspective on this, I don't know where you're at on this, but how do you see value-based care changing healthcare or changing your practice and how it operates? Do you see it, interacting right now? Is it affecting you right now, or do you see it?
It does. I have to provide good health care at reasonable prices and do what's best for my patients, but not cut the quality of care that you're getting. And that should be some guidelines that we need to follow, and people need to follow the standards of care as well. It's not like it's cookbook medicine, but we need to have certain standards that we go by. And like I said, I want the patient to be involved in these decisions. Well, I think people kind of give me the reputation here as Dr. Lee wants to do all these tests and do all these things. But in the long run, if we can prevent these complications from kidney failure, heart disease, that shows you that preventative value-based medicine works.
Yeah. There's a lot that has to change to make it make sense.
But we all need to work together instead of someone just dictating to you that, hey, come in, look at how my practice works, how it runs, and not just, one recipe for everybody.
Yes, ma'am. Yeah, it's very personalized. Healthcare is very necessary.
And I like my patients to be engaged in the conversation about what we're doing and to understand why we're doing it and why you take this medication, and not me just say, well, you need to take this, you need to do this. Even though I think I've kind of gotten that reputation as, well, Dr. Lee likes to tell me what to do and she's gonna, I'm not, I care. If I didn't, I don't think I'd, go this hard at it. My patients, I built my practice through the years, and most of my patients now are referrals from other patients.
Gotcha. So we're ambitious in our goals here. We love to get our patients off their medications through working on these lifestyle changes and really engaging and driving that home in their home with them through technology, through other means. That's really where we see things going. It's what we're already doing in select areas. And
I like to engage family members, even though my patient may not be willing to accept these new innovations, new technology. I'd like to get family members involved. If you can't do it, bring somebody with you and we'll show them how to do it. Introduce you to the devices and teach them.
Absolutely. That's key. That is key. Caregiver support, family member support. What, anything else that you'd like to say today?
Well, we're all going through this with COVID-19. We're all in this together. We need to be united to do what we need to do to overcome this, and all need to work together. And like with the vaccines coming out, everybody's excited about what could this mean for us all. Want to be safe and not rush to any, rush into things. But like I said, the therapy that's out there and that we're learning as we go. But, we don't want any more lives lost.
Absolutely not. We definitely learned a lot, and we'll continue to learn and get better at this. And I think we have so much opportunity to get people healthier when you look at how much chronic disease is out there and how much lifestyle can play a role in that, and how the whole community has to come together to be a part of that solution. So Dr. Lee, where can somebody find you if they're interested in connecting with your practice?
Like I said, I'm located at South Georgia Medical Associates at 410 Conner Road, Valdosta, Georgia. Our phone number is 229-244-4720. And I actually am an internist that takes care of my patients, outpatient and inpatient as well.
All right. Well, awesome. Thank you, Dr. Lee.
I try to follow you all the way through.
That's great. Thanks, Dr. Lee, for joining us, and we highly promote and love working with you in our pharmacy and other areas of services that we provide. And we thank you for everything you do on the front lines of taking care of people and working to get people healthy, which is what it's all about. So with that, we will sign off today. just remember that we have to take care of ourselves, and we have to be engaged in the process. There's a lot of great resources, a lot of great physicians, other healthcare professionals out there, and we can all make a difference individually. Thank you. Take care. Talk to you next time.
Thank you.